Welcome to Sustainable Health Empowerment's Health Education Series. I'm Melissa Ishimoto, a third-year medical student at Mayo Clinic, Alex School of Medicine. I was the student director for Sustainable Health Empowerment for 2 years, and I've volunteered with them since 2016. Today, we are going to learn what the coronavirus is, how it is spread, how to prevent its spread, what the symptoms are, what to do if you become ill, and finally, identify who is most at risk. So, let's jump in right now. Our objective for today's episodes are: what is COVID-19? How is it spread? What are the signs and symptoms? And why should I get vaccinated? Coronaviruses are a large family of viruses that are known to cause illnesses, ranging from the common cold to more severe diseases. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. They are named for the crown-like spikes on the surface of the virus. COVID-19 is spread when an infected person breathes out droplets, small particles that contain the virus. These particles can be breathed in or land on other people or on surfaces they touch. The primary means of transmission, that is, spreading of the virus, are breathing in droplets, being within 3 feet of someone who has it, or touching them, such as shaking hands, hugging, or being in a crowded area with poor ventilation. Some people have few or no symptoms. Many, however, especially those in greatest danger, such as those who have a chronic health condition like diabetes or heart disease, or the elderly, do experience some symptoms within 2 to 10 days after exposure. These are some of the symptoms: fever or chills, cough, shortness of breath or difficulty breathing, loss of taste and or smell, headache, fatigue, and muscle or body aches, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. So, how can you protect yourself and your family from COVID-19? Here are some things you should do to protect yourself and your family. First of all, get vaccinated and get the booster shots regularly after you are vaccinated. These shots are free. They may result in a very sore arm and some body aches, headache, or slight fever, but they will protect you from being dangerously ill with COVID. Wear a mask, especially when out in public or crowded places. Wash your hands regularly for 20 seconds using soap and water. You can use an alcohol-based hand sanitizer if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay 6 feet away from others, especially when you know there's a recent outbreak. If you're wearing a mask, sneeze or cough into your mask and then get a clean one as soon as possible. If you're not wearing a mask, cover your nose and mouth when you cough or sneeze with a tissue, and then throw the tissue away and wash your hands. If you don't have a tissue, cough into the inside of your elbow. Disinfect surfaces such as doorknobs, countertops, tables, light switches, phones, keyboards, and appliances regularly. There are 2 different tests for detecting COVID-19. A viral test checks specimens from your nose or mouth to find out if you're currently infected with COVID-19. Antibody or serology tests look for antibodies in your blood that fight the COVID-19 virus. Antibodies are proteins that are created by your immune system to help fight off infections. Viruses are very smart, meaning that they change constantly to stay alive because they need to keep infecting people to stay alive. That's why there have been so many variants of COVID over the last 3 years. If you have been exposed to COVID, these are the things you should do to prevent spreading the virus. Stay home, separate yourself from others, and let work know you are sick. Also, call ahead if you plan to see a doctor because some may not want you to come in. As I mentioned before, wear a face mask, cover your cough, wash your hands regularly, and avoid sharing items with others. Monitor your symptoms and call your healthcare provider if they worsen, especially if you start to have trouble breathing. So if you do get COVID, what should you do? Most people have flu-like symptoms and recover on their own. There are some things you can do to relieve symptoms known as supportive care. You may take over-the-counter pain relievers to relieve fever and pain, Warm showers or a humidifier can help with sore throats and coughs. Drink plenty of fluids and rest. If you are very ill, call your doctor to get a prescription for Paxlovid, which can shorten the time you are ill and prevent long-term effects. Today, we have discussed COVID-19, how it works, how it spreads, and how to prevent it. Most important is getting vaccinated. Like other infectious diseases we have conquered, COVID-19 can be prevented with regular vaccinations. So, protect yourself and your family now. Thank you for tuning in, and be sure to check out this episode and all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment. A special thank you to Wired International for the development of the content of this presentation, and to Khmer TV and Sustainable Health Empowerment. We'll see you next week. Here's to good health and good habits.